Hi everyone! Today's presentation will be on the Population Health Promotion Model created by Health Canada in 1999. This presentation is intended for HSS4110A, Population and Public Health. So my name is Alexandra, and I'll be taking you through the first half of this presentation. Today's agenda will include a brief introduction with an overview of the Population Health Promotion Model. Next, we'll take a closer look at the Population Health Promotion Model and get into some details, after which we'll look at the many ways that the PHP model and population health are connected. At this point, my partner Ethel will take over, providing an example of a research study that uses the Population Health Promotion Model to focus on improving maternal migrant health outcomes. Ethel will take you through how this study uses the PHP model and will end off the presentation. All of our references can be found on our final slide. As mentioned earlier, the PHP model was created by Health Canada in 1999. The PHP model was created as an amalgamation of many ideas surrounding population health and health promotion to create a framework with the best of both worlds. A new perspective on the health of Canadians was published in '74, opening up discussions of how health outcomes can be impacted by things that do not relate to health in and of themselves. These factors were things like lifestyle, environment, socioeconomic status, etc. In '86, the Ottawa Charter for Health Promotion and Achieving Health for All, a framework for health promotion, were published. This brought further attention to the social determinants of health and the need for a new model that addressed the changing context of health. As we learned in Module 1 of class, the PHP model is based on 7 values and assumptions. Here I will only list them briefly since we already went over them in class. 1. Comprehensive action. 2. Health organizations must analyze all action possibilities. 3. Multiple points of entry for planning and implementation. 4. Inequitable health disparities. 5. Health is a result of individual and societal factors. 6. People must have an environment that facilitates health and well-being. 7. Healthcare, health protection, and disease prevention work in collaboration with health promotion. Continuing, to use the PHP model, you need to ask yourself 3 questions. What do we want to focus on? How should we approach this? And who should we collaborate with? Furthermore, the PHP model should be used with quality evidence that has trustworthy data in order to ensure that policies and initiatives are developed using evidence-based decisions. Sources of trustworthy data include peer-reviewed research studies, experiential knowledge from industry experience, and/or evaluation studies. How does the PHP model and population health interact? According to the Public Health Agency of Canada, it explains the relationship between population health and health promotion. It's a part of population health because it aims to improve the health of the target population. The target population depends on how one applies the PHP model. So, if we remember the image that was shown on the previous slide, it acts as a guide to demonstrate how to use this figure. For instance, this is an example if we wanted to create a study using the PHP model. We want to focus on physical environments to address environmental racism that results in health disparities. This would be the what. We want to collaborate with the community. This would be the who. And we could address the issue by creating supportive environments. This would be the how. Next, Ethel will be taking you through an example of a real research study using the PHP model.
Hello guys, I'm Ethel, and I will be taking you through our selected research study that uses the PHP model. The title of the research study is Developing Population Interventions with Migrant Women for Maternal-Child Health, a Focused Ethnography. This study focused on exploring issues faced by migrant women in the area of maternal-child health and psychosocial health, as well as effective population health interventions from the perspective of the migrant women themselves. Although existing interventions for migrant women were established using the PHP model, the study sought to determine how the PHP model can be used to conceptualize the population health interventions suggested by the international migrant women who participated in the study. So for this study, 16 international migrant women living in Toronto or Montreal that had been identified as having a high psychosocial risk profile from a previous study were enlisted as participants. The enlisted participants were classified as vulnerable or resilient based on mental health indicators. In the study, the researchers sought to determine what processes are used by migrant women to respond to maternal child health and psychosocial concerns during the early month and after birth. Which of these enhance or impede their resiliency? And which population interventions they suggest best respond to these concerns? The method used for this study was a focused ethnography including in-depth interviews and participant observations. The results of the study showed that migrant women had coping strategies to address maternal child and psychosocial concerns. Some of these strategies included advancing their own education, seeking formal health care, increasing self-awareness, and praying, or basically like improving their spirituality. The coping strategies used by resilient mothers versus vulnerable mothers differed. However, social inclusion identified as an overarching factor to boost resiliency by all participants. The social determinant of health categories within which the suggestions of the mothers fell included income and social status, social support network, education, personal health practices and coping skills, healthy child development, and health services. Most of these suggestions were related to creating supportive environments and building healthy public policy. How can PHP model be used to create solutions to improve migrant maternal child health and psychosocial concerns? On this slide, we can see that the study addresses on what should we take action, how should we take action, and with whom should we take action. Based on the suggestions from the participants, modification of existing interventions as well as creation of new interventions are needed within education or daycare, housing, employment, immigration, welfare, and health sectors in the PHP model. Key sectors are immigration and health, as policies in these sectors are key to improving the concerns of international migrants' mothers. In a nutshell, we can see that the PHP model explains the relationship between population health and health promotion. The model guides action by asking, on what should we take action, which is usually related to health determinants. How should we take action, which involves comprehensive strategies, and with whom should we take action, which determines various levels of actors. Policies and interventions in population health programs may operate within or outside the health sector, but have the potential to impact overall health population. Based on the study discussed in this presentation, it can be seen that there needs to be improvement in the existing policies that are tailored to the population health promotion model. Also, more interventions need to be created that are more suited to the needs of international migrant women. In doing so, their health and that of their children will be improved. This is the end of our presentation. Thank you for listening.
Thanks for listening to our presentation, and I hope you learned something, and we'll talk to you guys in the discussion.